Samuel has been having difficulty seeing for quite some time, but being stubborn, it took several months of badgering from his daughter Catherine to admit it. Catherine's concerned about her father's eyesight. She wonders if it's still safe for him to drive, especially at night. She decides to start taking him to his appointments as a precaution and to hear what the doctor really has to say. Dr. Kelly has been an ophthalmologist for years. She loves what she does in helping treat issues and restore vision, but her job is complicated by a lack of monitoring options. Every day, she does her best to assess and treat patients, many of whom are elderly and often don't seem to remember all of her instructions. She wonders if they follow the routines and medications she prescribes, especially when their glaucoma shows steadily increasing worsening despite their pressure readings always reading normal during office visits. She wishes there was a way to monitor her patient's intraocular pressure and thus be able to more effectively track the effects of medications and treatments. Catherine wished she could do something to help manage her father's condition better, but with limited information and nothing to go off besides routine medication instructions, she didn't know what to do or look for. And getting more appointments with Dr. Kelly was difficult. She seemed to always be booked. Glaucoma is a tricky disease to treat because at the beginning it has no obvious symptoms. When the first vision loss is detected, the optic nerve is already irreversibly damaged. This damage is caused by elevated intraocular pressure. Glaucoma is the leading cause of irreversible blindness, affecting 80 million people worldwide, 5 million in the US alone, and that number is only increasing due to our aging population and lifestyles. IOP reduction and control is the primary objective of any glaucoma therapy. Current procedural monitoring and treatment isn't effective enough. By improved monitoring, eye doctors receive more actionable information. Now, thanks to implant data ophthalmic products, there's a solution: the Eyemate. A fully integrated system for close monitoring of IOP, the Eyemate is a personal pressure reading tool which allows patients to check their own eye IOP anytime. The implant is made out of high-quality, stringently controlled, biocompatible materials so that it can remain in the eye indefinitely and done in tandem with another surgery such as cataract. A microsensor embedded in the implant measures the intraocular pressure and wirelessly transmits the measured values to the reader device, or fully automated with data simultaneously transmitted directly to the doctor. This enables the doctor to more effectively monitor treatment plans and determine whether or not medications and therapies are working, so they can adjust dosage and plans as needed in response to pressure readings. Patient self-measurement provides peace of mind. Samuel was able to take his own IOP, providing both he and his daughter concrete readings to better understand his current situation. Dr. Kelly is able to provide better care to her patients by avoiding the trial and error therapy process, avoiding irreversible damage errors. Plus, she doesn't have to squeeze in as many office visits since general monitoring can be done at home. It's time to take the mystery out of glaucoma care. Simple, independent monitoring, anytime, anywhere. The Eyemate, destined to transform glaucoma care.